All right. Hello, everyone, and welcome to this webinar with athenahealth and Fullscript. My name is Kaylee. I'm on the marketing team here at Fullscript, and I know you can't see me, but I will be here with you throughout the whole presentation today. Before we get into the presentation, though, I'd like to quickly introduce our host for today. So we have Dr. Jeff Glad. He is Fullscript's Chief Medical Officer and an MD with a focus in integrative medicine, among many other things. We are also joined by Dr. Eric Viegas, is a naturopathic doctor who is also Fullscript's Manager of Medical Operations. And lastly, we'll hear from Dr. Chrisopher Knee, who is also a naturopathic doctor and Fullscript's Manager of Medical Education and Research, among many other things, of course, these hosts today, but will be joining us to discuss a few things and also include a demo of the Fullscript and athenahealth integration. But let's kind of go over what we plan to go through today. So our doctors will be diving into what Fullscript is. They will also have a presentation on the importance of supplement quality, as well as efficacy and adherence. And of course, as I said, we'll see a quick demo of the integration in action. So with that being said, I'm going to pass the presentation off to our first host, Dr. Jeff Glad, to kick things off, and I will join closer to the end for a live Q&A.
Thanks, Kaylee. Hey, everybody. As Kaylee said, I'm Jeff Glad. I'm the Chief Medical Officer here at Fullscript, as well as a practicing integrative medicine physician in Indiana. I want to introduce the company and give you the high-level view of the platform, and then let some of the team members Kaylee mentioned from the medical team introduce a few of the features of the Fullscript platform that we're most proud of. Fullscript is a powerful, free, personalized care platform offering treatment planning, active wellness support, and healthcare's best supplements and wellness products for you and your patients. With over a decade of development and use by more than 70,000 healthcare practitioners, serving over 5 million patients, Fullscript delivers the scale, technology, and expertise to support the growth of personalized medicine and the delivery of high-quality care. We've built a world-class experience for both you, the provider, and your patients. You can see on the left side of the screen the ease of creating a patient, which actually is even easier when you use the interface inside of the athenahealth platform. But then the ease of having the information you need to choose ingredients, doses, or protocols for your patients at the point of care. You also have at your fingertips in the same window the ability to add professionally authored content from our medical team to attach education or handouts to those recommendations. From the patient perspective, they have the ease of signing up on any device, accepting their treatment plan, and utilizing a one-click checkout. After that, you both rely on us for providing the delivery, auto ship options for longer-term supplement plans, and additional tools like refill reminders. We know that most of the time, new technologies in practice actually add more work to you. We wanted to create a streamlined workflow built on efficiency and increased visibility to you inside your current workflow. In order to deliver this, we focused on 3 main areas of our build. The first, we sync patients between platforms to reduce the admin burden, as well as make it easy to add new patients or match existing ones to Fullscript. We also make it easy to access our bread and butter, the treatment planning tool. As one of your first embedded apps, providers can now leverage our award-winning tool to recommend the highest quality supplements and natural care products without ever leaving your athenahealth platform. We then push back to the consult note what you recommended. We also have the option to copy a plain text summary to paste elsewhere in the chart. We built this because it was requested by most practitioners to be able to write back to the medication section, but we were unable to do that as an integration partner. So we decided that the next best option was to allow providers or your staff to be able to do that within the chart. We'll be providing a demonstration of the Fullscript platform, as Kaylee said, at the end of the session, diving into more detail on each of these points. So for now, I want to focus a little more on how Fullscript solutions work to give you confidence in supplement quality, and how Fullscript focuses on providing evidence-based decision support and works to support your treatment plans by using our built-in adherence tools. I'll be passing it over to Dr. Viegas now.
Thanks for that great intro, Dr. Glad. I'm Dr. Eric, as mentioned previously, and let's jump into supplement quality. So quality is essentially about building trust and transparency. You want to know the journey of the ingredients you're prescribing from seed to supplement, so to speak. So looking at sourcing standards, the origin of the ingredients, manufacturing standards, the trust in the brands you're using, product integrity, so the quality behind the finished product, and something that I think is often missed when assessing supplement quality, distributor standards. So as you'll see throughout the next few slides, there are tons to consider with respect to evaluating supplement quality. And this is, of course, something that most providers don't have the time to do themselves. But this is where Fullscript provides the supplement quality solution. We do this for you to make sure that your patients are only accessing healthcare's highest quality supplements. Now, in terms of ingredient sourcing, optimal safety and efficacy relies on accurate sourcing, identification, validation, and processing. There's no shortage of news stories around the identity of botanicals and ingredients in supplements not being the same as what's advertised on the label. So I want you to all think about the origin, location, and environmental stewardship behind your ingredients. Do local ingredients matter? Do wild harvested or sustainable ingredients matter? Do you want, the suppliers to think about environmental stewardship when they're harvesting, so it doesn't impact nearby ecosystems or communities? You also should be thinking about derivation and processing of the ingredients. So how are they handled? How are they cleaned? Are they exposed to any sort of chemicals or solvents that could then be residues in the product? And of course, ingredient analysis and certificates of analysis. So making sure, again, what's on the label is what's in the bottle. Again, remember, you can't make a good meal with poor ingredients. So these are all of the factors to consider. Now, in terms of manufacturing, I do want you to just take a look at the bottom row of this table. So here are some examples of methods and considerations when it comes to raw materials, manufacturing, and finished products. Ideally, you look for CGMP seals on products and in product spec sheets from the company. CGMP assures proper design, monitoring, and controls of manufacturing processes and in facilities. And something to note here, the FDA allows companies to individualize the implementation of CGMP controls. So that third-party CGMP certification is very important here if you want that added quality assurance. And when you're meeting with sales or customer service reps, ask them about raw materials and finished products. Ask them specifically about testing frequency. Is every batch tested? Is every other batch tested? Is every third batch tested? You might be surprised to hear their answers. Now, the FDA does require testing and a certificate of analysis to prove, what's in a company's bottles. But these standards can be chosen and developed by the companies themselves with no obligation to publicize their standards. So again, third-party certification is very helpful here. These are companies that independently audit, they inspect, they verify ingredient sourcing, product manufacturing standards, and distribution. And again, can help to add to those quality assurances. So there's no shortage of third-party certifications out there: NSF certified for sport, USDA organic, non-GMO, B Corp. The list goes on. And I encourage you to find a third-party certification organization that aligns with your goals as well as your beliefs for both yourself and your patients. Now, distribution, this is something that I think is often missed when assessing supplement quality. These are all factors post-production. So packaging, you want to think about the timing of packaging, preservatives used, moisture mitigation. Moisture is the enemy of a lot of supplements, including probiotics. And thinking about spoilage prevention methods. So in addition to that, thinking about expiration standards, right? Are you going to get a product that will expire in a couple of weeks once it reaches your patient? Or does that distributor have, expiration standards in place? As for storage, for sure you want to make sure that there are temperature and humidity controls in place. Again, for products that are not shelf stable, probiotics are a good example here. Some are shelf stable, but others require refrigeration to slow colony forming unit loss or CFU loss. Are there appropriate containers for storage here? Are they mitigating light exposure for ingredients that are sensitive to light and heat? And then for labeling, details including ingredient identity, source, quantity, and quality. And for transportation, not just cleaning conveyances between deliveries, but taking measures again to avoid moisture, to control humidity, to control temperature. And then within the distribution center itself, segmentation, making sure that organic and non-organic ingredients are separated during storage and transport. And finally, documentation. So making sure that there are records stating adopted standard operating procedures and maintaining those records over time. So how does Fullscript solve for supplement quality? Now, Fullscript has created the supplement quality program to make sure that your patients are only accessing healthcare's highest quality supplements. There are many different reasons why a quality program is important. And when we survey our customer base, we know quality of supplements ranks as a top priority for providers. MDs and hospital systems in particular are very concerned about supplement quality, as they should be, since it relates to patient safety and outcomes. But there are plenty of practitioners and patients that actually don't know where to start with supplement quality, or even what questions to ask about supplement quality. The quality programs at Fullscript and at Emerson give providers and patients an easy way to understand which brands have higher quality practices, and this helps them to learn about the differences of products in the same supplement category. Just a note here on resources, we do have resources on supplement quality for providers and patients, both in the app and on fullscript.com. So I would encourage you to check them out. So what is the Emerson Quality Program? So as many of you know, earlier this year, Fullscript acquired one of the industry thought leaders with respect to dietary supplement quality, Emerson Ecologics. And the EQP, the Emerson Quality Program, was so robust that Fullscript chose to maintain it, and we're working on integrating and evolving it. The EQP was founded in 2009 in response to demands of healthcare systems wanting additional quality assurances. It was designed to provide reliable information about the quality standard of participating brands. You can see here on the slide, the two levels of the EQP currently are silver and gold, and there are also Emerson quality qualified suppliers. And you can read more about the different standards for each tier on this slide. Now, the benefits of Fullscript's quality program. Now, something to highlight here, the EQP does provide, or the Fullscript quality program does provide quality assurances for providers, but it does not provide full safety assurances, since safety has an element of provider experience, education, clinical judgment, as I'm sure Dr. Knee will cover in the next section. A product can be generally regarded as safe and have high quality ingredients, but it can be used unsafely if the provider is untrained or inexperienced. Now, something to note about the Emerson Quality Program and the Fullscript Quality Program, it's free for brands to join. Brands don't pay to be a part of the EQP or for the ongoing costs of audits and product testing. Fullscript will actually maintain all of that into next year. And we're also hoping to integrate the EQP badging into the catalog. Additionally, we'll also be adding content to highlight key takeaways from our testing, which is performed every quarter on EQP members, and our facility audits. Finally, a note about quality filters here. So this is a showcase of the filter feature that allows you to filter by some of the identified quality considerations we just went over. They're all accessible from within the integration experience we've delivered in the athenahealth workflow. So you can look for a specific form of ingredient. Maybe your patient wants to avoid a capsule or a tablet and they prefer a liquid. You can filter by that. You want to maybe limit, you want to look for products that are soy-free, dairy-free. You can actually search by those filters. And then for certifications, we have those built into the search feature as well, along with limiting excipients, including or excluding ingredients, and more to find that personalized supplement for your patient. And now I'll pass things off to Dr. Knee.
Great. Thank you, Dr. Viegas, and thank you, Dr. Glad, as well. So now that Dr. Glad has kind of covered at a high level some of the benefits for using Fullscript as a platform and an integration within Athena, and Dr. Viegas covered some of the important quality considerations when selecting a supplement, I thought I would just take a few minutes and go over some of the clinical decision tools that we have available, as well as some of the medical education resources that you can access with your free Fullscript account. So just starting from the top here, some of the clinical benefits of just using a technology platform in general. So obviously things like EHRs and e-prescribing compared to writing written prescriptions do tend to lead to improved patient safety. This is usually via just improved legibility, clear communication, reduced errors, and reduced wait times. So unlike having to write out a prescription by hand for your patient, and unlike just providing a verbal prescription, let's say for vitamin D, when you can prescribe through a digital format, it typically leads to better adherence, and the patient has a better understanding of what they're looking for. So I always relate this in practice to having a clear record in my EHR of what I've recommended and what the patient is taking, as opposed to just recommending go find some vitamin D, and then the patient, of course, is left to go and search either online or through different health food stores, and they're often unclear about what brand to select, what formulation, what dose, whether to select a liquid or a tablet. So providing this digitally right from your EHR is a great way to provide that communication. We do see from some of our research that there is improved adherence with digital versus written prescriptions, and of course it does save you time as well to be able to do this directly from within your platform. Beyond just some of the benefits of using an EHR integration, Fullscript does offer evidence-based decision support tools and prescribing tools. So one of our most popular features would be the evidence-based protocols that we have directly within the app. So we have 40 plus customizable and shareable protocols that are all evidence-based. So these are developed by our integrative medical advisory team. Essentially, this is to serve as a starting point for practitioners or providers that might not be familiar with what to recommend, or you want to look at some of the detailed evidence for different supplement ingredients with respect to certain conditions or health concerns. So we have, like I said, 40 plus protocols in different categories, from cardiovascular support, GI support, and so on. And essentially, this is meant to guide you towards that recommendation, as well as provide you with point of care reference to some of the supportive evidence. So you can look through here and see information such as dosing, safety information, linked out to some of our ingredient reviews that we have in our ingredient library, as well as select or choose from our pre-selected products in the app, so that if you're not quite sure which brand to recommend, we provide you with a template just to kind of get started with doing that. And of course, they're fully customizable, so you can swap out products as per your preference. You can also share these with many different audiences, so they're shareable in the sense that you can share them with patient groups by email, social media, and so on, if that's up to your preference. One of the other great tools that we have available to us, which is developed by Dr. Glad, is the mitaven.com depletion checker. So you can go to mitaven.com and simply enter the name of a medication that your patient's taking, and this will give you a good starting idea of some of the possible nutrient depletions that might be occurring as a result. So again, this helps lower the barrier to prescribing, because if you're not sure where to start from a condition or health concern perspective, we often find it helpful just to start with some of the medications they're taking, and ensuring that if there is a significant depletion associated with that medication, that's a good starting point just in terms of compensating for some of those through supplement recommendations. Beyond the mitaven.com depletion tool, we also offer a wide variety of different drug nutrient educational resources. So I'll talk in a little bit more about our resource library, but we have several different practitioner guides, different checklists and reference sheets on the topics of drug nutrient depletions and interactions. These are all linked within the slide deck as well, that you can access afterwards, or reach out to us directly if you'd like additional information. One of the other key themes that you'll see coming through our Fullscript platform is the topic of treatment adherence. So this is something we've been researching on the medical team for the last couple of years. And essentially, treatment adherence, as you're likely aware, is a little bit different from compliance, but it's the extent to which a patient is able to follow their treatment plan. So we recognize as integrative medicine providers that simply providing a treatment plan to a patient does not do enough in terms of helping to support long-term adherence and lifestyle change. So we've done a lot of research into better understanding the different types of barriers and facilitators for treatment adherence. And this came out through our research in 2021, which is published in a PubMed peer-reviewed journal called IMCJ, and also led to the launch of our white paper in 2022 on behavioral change. And what we found from some of our research was that, as high as 15 to 30% of patients won't even act or initiate a treatment plan for the first time. So even if you're providing that recommendation, whether it's supplements, diet, lifestyle, and so on, or medications, 15 to 30% of patients are not going to even act on that. And this goes up to about 50% long term. So in patients with chronic disease, which we know are the majority of patients in North America, they will have 1 in 2 patients is actually following a treatment plan long term. So we've recognized the importance of this, and we've built into our platform and our tooling some of the different types of features that we know will help support adherence. So one of these strategies to start with would be cost. So of course, cost is a primary barrier to patients being able to purchase supplements or follow a treatment plan. And we've seen, especially in the current state of the economy, that discretionary spending on supplements has become a major topic of concern. So what we want to do is try to find strategies to help lower that barrier for patients. So of course, some of the strategies we highlight and we try to build into the platform, something like a cost filter, for example, so you can search an ingredient and sort by cost if you're looking for the least expensive vitamin D, let's say. We also recommend to our practitioners prioritizing supplements, so helping to identify which ones might be more important for a patient to start with, differentiating between acute and chronic use supplements. We always recommend, where possible, selecting combination ingredient products. So rather than recommending different products for calcium and magnesium or different adrenal support products, choosing combination products that contain a blend of ingredients so that you're having them on maybe 1 or 2 supplements as opposed to 6 or 7. And again, the number of products makes a difference as well here, so that will help lower the barrier. And if possible, and if your account allows for it, consider lowering margins or offering discounts, opting into different promotions that we have. For example, the upcoming Black Friday and Cyber Monday promos. These are all different ways to help kind of encourage cost effectiveness for your patients. One of the other key strategies we recommend is just simplifying treatment plans and prioritizing supplements, like I said. So there's ways to do this through your prescribing tool and through that treatment tool in-app. But there's also, things that we recommend just generally. So reducing the number of supplements you recommend. So a little bit counterintuitive, but patients actually are more likely to place an order when there's only, 3 to 5 supplements recommended compared to 5 to 10. And this, is difficult to do sometimes as a prescriber where, there's a lot of different things they can benefit from. But again, it's all about optimizing patient adherence and just getting them started. And then once they're able to become adherent to a treatment plan, they're more likely to stay engaged and order more products down the line. We also recommend trying to simplify your dosing. So there's lots of different ways to do this within the treatment plan as well. Typically, it comes with kind of the recommendation or the manufacturer recommendation dosing, but you can fully customize that. So if you'd recommend that they take it just once a day versus 2 or 3 times a day, that's a good way to optimize adherence, as well, like I said, of combining products or sorting them so that they know which ones to focus on. We're also, just a bit of a teaser, we're exploring the opportunity of pill packs and trying to combine some of these products from our protocols so that, again, we can just increase adherence and also make it easier for practitioners to choose a protocol and just recommend that as a treatment for their patients, as opposed to having to worry about multiple different products at a time. So like I said, we've developed a fairly extensive research program and education program in these areas. So these are just a snapshot of some of the different educational resources and tools we offer. So like I said, behavioral and lifestyle medicine is a current big theme for us. So we've developed things like readiness to change questionnaire, health empowerment questionnaires. There's different types of worksheets and tracking tools all available in the resource library. So I'd recommend checking some of these out. It's a good place to get started and gives you a lot of guidance as a practitioner with respect to some of those practice management considerations. And one more adherence strategy to touch on would be just the importance of patient education. So I cannot give a presentation without talking about the importance of this. So patient education really helps increase health literacy, which ultimately drives adherence because they understand about their treatment plan, why they're taking certain things, their condition, possible side effects, and so on. They're more likely to remain engaged in their treatment plan, and research shows they're also more likely to be satisfied with the care that you provide. So we recommend that every treatment plan contains some type of information and that we don't let a lack of information or a lack of education be a barrier for patients to following a treatment plan or experiencing positive outcomes. So one of the great ways you can do this within the app is through our resource library. So we have over 150, now close to 200 different practice resources. These vary from short handouts and worksheets, like I mentioned, to more extensive patient guides, meal plans, recipe books, and so on. So like I said, this is really important to attach. You can do this directly from a treatment plan. So instead of just recommending supplements, feel free to attach that vitamin D handout to it just to give them that little bit of extra information that they might need to be adherent. And it also kind of helps reduce questions, confusion, and improves the relationship with the provider. So even if you're not quite ready to recommend supplements, I'd recommend creating that free account to check out the resource library because you'll have free access to these resources, even if you're not quite getting started yet with the supplement prescribing. And the last couple of months have also been a strong theme of gut-brain health for us with our medical education program. So just a snapshot here of some of the different types of educational resources we've created, everything from short handouts on prebiotics and probiotics to a stool tracking tool for patients, a meal planning tool, and a longer patient guide on the fundamentals of health and where to get started. And lastly, just to touch on some of the different types of tools that are available once you've actually delivered that treatment plan to the patient. So you've made a prescription, but it doesn't end there. Beyond that point, we talk about all the different adherence tooling we have in app. So just having feedback strategies can improve adherence by 10 to 20%. Things like having mobile device reminders, decreases the number of missed appointments and improve adherence as well. One thing we do from a supplement prescription standpoint is the refill reminders. So these are customizable and are basically just sent to a patient to remind them to purchase if they've ordered previously. Auto ship is another great way to do that as well. So this is, again, fully customizable, but by default goes in correspondence to the products that have been ordered and how long that product should last the patient. So they can set this up and customize it themselves. And two of the other practitioner-facing tools that we have available are the adherence survey and the insights dashboard. So the adherence survey is essentially a survey that's sent to the patient within a week of receiving a treatment plan or prescription, and basically just asks them if they've ordered, and if they haven't ordered, are there any particular reasons why, whether it was cost or they found the product elsewhere or they were confused by the prescription. These are all great feedback tools that are then sent directly to the practitioner's account, so you can review that and then kind of adjust accordingly. And the Insights dashboard is another great one, which you see in the screenshot at the bottom right here, basically highlighting that you can look at the last 30 days to basically see, which patients have ordered, which have not ordered. You can review that survey feedback if it's been completed by the patient, and you can also manually kind of set reminders, adjust treatment plans accordingly as needed. So all great tools that we're continuously improving on and just trying to work to increase that kind of partnership and using Fullscript as a technology tool to support the delivery of integrative medicine. So now that we've covered some of the kind of clinical decision support benefits and medical education resources available, we'll turn it over to Helen. We're going to play a quick video that really dives into the Athena integration and demonstrating that for you.
Hi, I'm Hala from the Fullscript team. Welcome to the Athena Fullscript webinar. Today I'm going to be showing you exactly how you can utilize the Fullscript integration from within your Athena charting experience. First of all, to turn on this integration, you will need to sign an authorization and consent form and wait for the emails coming to you from your Athena support, letting you know that the integration has been turned on. If you've gotten the email that the integration has been turned on, but you cannot see the integration in your Athena account, that might be because you are not the administrator of your Athena account. The administrator of your Athena account will need to turn this integration on for you manually on their admin user. So let them know, and they'll be able to turn that on for you in their settings. Assuming all is well, you'll go ahead and log into your Athena account. Go ahead and navigate to any patient or the patient that you intend to write a recommendation for supplements to. And you can navigate to the Fullscript integration pretty much anywhere within the patient instance. I have navigated to a patient chart, but again, you can do so from within appointments, scheduling, any sort of avenue to direct you to your patient instance. From there, you'll be able to see a button that says Apps towards the left-hand navigation bar. And Fullscript should be one of the applications in there, assuming, again, it's been turned on. Go ahead and click on it. This will direct you to the sign-in screen. So this only needs to be done once, the first time ever you utilize the integration, and it's directing you to sign into your Fullscript account. As a tip, if you don't have a Fullscript account at this point, feel free to go into fullscript.com and create one yourself to authorize and sign in with that account. Once you sign in, I'm going to go ahead and sign in. You'll get a connected successfully screen, which will then allow you to get started. Also note that at this point, if the button does not say get started, but rather says something along the lines of that we need a BAA signed with your practice, all you need to do is reach out to us at athenaintegrate@fullscript.com to start the process of setting us up with a BAA. The first step after signing in is to select your user account on Fullscript. This will only be applicable if you are also the administrator of your Fullscript account. After which, you will go ahead and match your patient from Athena to your patient at Fullscript. The integration has worked beautifully to suggest matching patients based on name and email address. So you can go ahead and match to your existing patient records on Fullscript, should there be one. Otherwise, you can go ahead and create a new patient using this button. I went ahead and matched my patient records, and now I'm ready to go ahead and recommend nutraceuticals or supplements from Fullscript within my Athena instance. You can go ahead and search the breadth of products or catalog that we have available. You can sort it differently, or you can actually create within the application or within this embeddable solution favorites. You can navigate towards your favorite products and recommend easily from there. You are also able to attach resources supporting handouts, things along those lines, whether from your uploads or built-in Fullscript content that's already curated by our integrative medical advisory team. Another quick tip is that you can create protocols or templates of products that you want to recommend together or in a series of products together for your patients. So I went ahead and created a test cold and flu protocol here. I'm going to go ahead and apply it. Also, side note, there is some built-in Fullscript protocols that have been curated and created by our integrative medical advisory team. And you're able to navigate towards these Fullscript protocols for ideas or suggestions, inspiration, and even able to just recommend straight from these protocols. I went ahead and applied my cold and flu protocol over here. You're also able to add a dedicated message and save some of these messages so that you can rewrite them or reuse them at later points. My built-in attachment sits right here. I'm pretty much ready to go ahead and send this off to my patient. So I'm going to go ahead and send the recommendation. This directs me to a success screen that tells me as the provider within my Athena instance that the recommendation has been successfully sent to my patient via Fullscript. At this point, if you want the information or a record of the treatment plan that you've just created to live somewhere within your Athena instance, you can go ahead and view the plain text option of your recommendation, copy that plain text, and place it pretty much anywhere you'd like this record to be saved. So this could be in your notes, this could be in your plan section, this could be under, the medication notes section. Any place where you feel that this should live, you could just go ahead and paste it there. Having said that, the Fullscript recommendation does default to a space in your consult note. So if I were to search my consult notes, I would be able to find or see the most recent recommendation that I wrote. In this consult note, it's created and closed. So the record is saved there by default, should you need it. And this pretty much concludes the integration between Fullscript and Athena. As mentioned, this pretty much helps you recommend nutraceuticals or supplements from Fullscript within your Athena patient instance. Have a great day.
Great, thank you, Hala. So just to finish up here with some additional resources, our team is on standby to answer any questions that you might have. Thank you again to Dr. Glad and Dr. Viegas, and I'll conclude it there. Please reach out if you have any questions.
All right, I'm going to jump back in. Thank you to all of our hosts, Dr. Glad, Dr. Knee, and Dr. Viegas, for giving us such a great jam-packed presentation. We do have a couple questions that have come through. So I have a couple, I think, to start with Dr. Glad, if that's all right. The first one we have here is Fullscript traditionally for holistic practitioners only?
It's a great question. I mean, I think, the holistic, integrative-minded practitioner is certainly going to be more comfortable with the catalog that we have. But we have made a lot of efforts to, with the content and all of the resources that have been built, to allow any practitioner, even if they're just getting started, to make supplement recommendations, to feel comfortable making those recommendations on Fullscript. I know when I started, 13 years ago, making a transition from conventional medicine to integrative medicine, it was really overwhelming to know where to get started. The content that's been written now is right at your fingertips within the Fullscript platform. The supplement recommendations, the dosing recommendations, and I felt most strongly when my patients were, going out to the health food store, to the grocery store, and buying clearly inferior products, that being able to connect them to the high quality products that Dr. Viegas mentioned was really important for them. It was important for their clinical care. So, I would say get started somewhere. Don't feel like you need to know the entire catalog. Have a couple really core supplements that, maybe you've heard about in a conference or studied the evidence on. Usually that starts with fish oil, vitamin D, probiotic. Certainly the catalog is going to help you choose, see what the most recommended products are in this industry. And that's where I would suggest getting started.
That's great. I think that rolls right into the next couple that were kind of asked was, and you've answered them, as how yourself did you get comfortable with making supplement recommendations for your patients, and what's the easiest place to start? And I think you kind of answered them with getting familiar with that catalog, and I guess just kind of trying it out and seeing everything that Fullscript does have to offer and the tools that are there to help you.
Yeah, I would add, outside of those pieces, just from a practical delivery of this kind of care, have conversations with your patients. Let them know that you're just getting into this and your understanding is growing. Your patients will respect that, and they'll honor sort of that humbleness. But that's what I would recommend is just kind of getting started with them. I can guarantee you most of your patients are really interested to have this conversation with you and to take your advice on where they should get started supplement-wise.
Mm-hmm. And appreciate the honesty that you're just also getting started too and are learning. The next question I think is more for maybe Dr. Viegas, is tell me a bit more about the Fullscript brand and products and how maybe we differ from other products on the market available to patients through other health stores.
Yeah, that's a great question. So we choose brands that are at a higher quality standard in terms of onboarding. So we request various documents. We look at the research behind the products. We look at the claims. We look at the certifications before onboarding. Additionally, as I mentioned with the Emerson Quality Program, any of the brands that are part of the EQP are tested every quarter. So every quarter, one SKU from every brand is tested. We do that testing on our own with an independent third-party laboratory. We choose to look at things like heavy metals, pesticide residues, identity, potency, and so forth. And we work with brands that are known in the industry as having that professional standard. They have medical advisory boards that help to create products, and they have research behind those specific products as well.
Yeah, great. And I know there was another question too, I think it was answered in the chat, but how many supplement companies do we actually have? And I know it's kind of a wide range between the US and Canada, but I believe we're more than 400 brands, about 40,000 products. But you guys might be able to speak a little more to that, but we have such a wide variety that there's something for everyone there. And then next question, I think actually I might be able to help answer a bit with maybe Dr. Glad's input. Basically, tell me more about how the experience works for the patient. So when the practitioner sends a recommendation, Fullscript notifies the patient that they have a new supplement recommendation from their provider. Fullscript has, a quick and easy checkout process. We can accept all major credit cards, Google Pay, Apple Pay, HSA, FSA to make it as easy as possible for patients. We have adherence tools in place to help keep them on track and refill reminders and auto ship so they don't have to think about things, which is great. That's kind of a high overview. I don't know, Dr. Glad, is there anything else you can kind of lend to that patient experience?
I think, Kaylee, you covered the core pieces. I would say another really invaluable tool, particularly for that early starting out doctor, is most of the supplements that you're going to recommend on Fullscript, it's going to automatically populate how to dose that. once a day, twice a day, based on what's on the bottle. And that's what your patients largely want to see from you as well. Now, as you get more experience, you sort of understand maybe a little bit about dosing. You can personalize that and change it however you desire. But that also is going to come through to your patients so that they understand kind of what the schedule of supplement dosing looks like for them.
Yeah, that's perfect. And I think the next question is also set up for you, Dr. Glad. It's asked, I am new to recommending supplements to my patients. Can Fullscript help me understand which are the best products to recommend? And does this impact the products that show up in my search? We may have answered some of this along the way too.
Yeah, I mean, certainly one of our challenges at Fullscript that we put on ourselves is to get better and better at the search experience and to be able to create a search experience really tailored to those doctors coming over from conventional medicine, getting more comfortable with supplementation. Right now, you're going to see the most commonly recommended products by the core integrative medicine practitioners. But I would also encourage you to spend some time in the references and all of that education that the IMAT team has put together and pinning the references for that supplement, for that standardized dosage. And then you can search by ingredient. You can search by dosage and really start landing on those products. And what's most important is don't, spend all that time searching for one patient and then not forget to favorite it or put it into a protocol so that you have it at the ready for the next patient and the next patient and the next patient. So that's the beauty of Fullscript, is really allowing you to tailor it to your practice so you can streamline that workflow that we talk so much about.
So I think we're kind of closing in on, there's a couple questions that are kind of around the same topic that I might be able to kind of end with here, or close to end with. And it's around how long does the integration take to get set up and how easy is it to get started. So it only takes a few minutes to create a Fullscript account. The Fullscript account is also a free account. And once you have signed the athenahealth authorization and consent form, they review it, approve it in a few days or so, and in the meantime, we execute a business associate agreement. So there's a couple forms to fill out, and just ways you can expect to be using the integration and consenting to it. It takes a very short time. There's steps along the way. We have a whole team ready to help you. Once you're kind of approved, you can go into your athenahealth marketplace and click the contact partner button. From there, we walk you through executing actually all of the steps needed if you haven't filled out any of the forms, and we establish that account and get you started kind of as soon as we can, make you feel comfortable and confident. There's a team, as I said. You can set up demo calls. There's tools to help you. So there's teams on both sides of our partnership here ready to help and ready to answer any questions. And there's resources available. So yes, as I said, Athena's marketplace, fullscript.com/integration/athenahealth also has some demo videos as well. I think you can find everything within the marketplace as well. So there is lots of help out there, lots of teams willing to provide you answers as fast as you can. If there is any more questions, I know there is an email. Do we have it on the screen? Yeah. integrateathena@fullscript.com. Reach out there and we can help you there. I know through the marketplace as well, there's a team. And I will let everyone know here that you will be getting a copy of the presentation as well as the slides and the resources. We have some extra resources to share from our IMAT team here as well. So, with that being said, I'm going to give a big thank you to our hosts, Dr. Viegas, Dr. Knee, and Dr. Glad for being here with us today. A jam-packed educational webinar that I think has such valuable information and I know is very, very thoroughly enjoyed. So thank you for being here, and we hope to hear from you all and see you all in the future. All right. Thanks, guys. Have a great rest of your day.